Below normal for this time of year. Tonight, a chance for some rain early, mostly cloudy with lows in the low to mid 60s. And tomorrow, partly sunny with scattered afternoon and evening storms. Temperatures are back in the upper 70s to low 80s. I'm Kat Campbell in the weather.
Welcome to Cape Fear Valley's Making Rounds Live, broadcasting and streaming live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, and WEWO in Laurinburg.
Making Rounds Live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making Rounds Live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
Thank you so much, Ray. Welcome to another edition of Cape Fear Valley Health's Making Rounds Live. I'm your host, Omega Jones. May is Stroke Awareness Month, so today we'll talk to Cape Fear Valley neurosurgeon Dr. Melissa Stoumatis and Cape Fear Valley stroke coordinator Megan Dornan. Today, before we even get started, please remember that this broadcast is not a time for you to self-diagnose. This is for informational purposes only. So if you find yourself, a family member, or a loved one suffering from anything that we discussed today, you need to dial 911. Yeah, it's that serious. So here are some facts for you. Did you know that stroke is the leading cause of death and it can happen to anyone? The state of North Carolina is known as the Stroke Belt. Why is the state of North Carolina known as the Stroke Belt? Well, basically that means that we live in the southern part of the country where stroke cases are most common. That means more than any other region in the United States, and at least 10% higher on a national average. And according to the Centers for Disease Control website, almost 300,000 North Carolina adults have experienced a stroke in their lifetime. And in 2023, the state had a stroke death rate of 42.2 per 1,000 people. That's almost 1 in 25 people in the state. Now, to help you understand all of this information and to make sure that all of these statistics are accurate, here is where we introduce today's guest. First, ladies and gentlemen, please welcome Dr. Melissa Stoumatis and Megan, I'm getting ready to call you doctor.
I'll take the permission.
And Ms. Megan Dornan to the broadcast. Ladies, thank you so much for taking time out of your busy schedule. I know you ladies are busy, but it's an important time to educate our community on stroke. So thank you so much for being on today's broadcast. Now, Dr. Stoumatis, we're going to start with you. We're going to start with the basics. What is stroke?
Thank you so much for that introduction, Ms. Jones. A stroke is often akin to being called a brain attack, if you will. And people may notice a sudden change in their vision or functioning that disrupts their day. Those symptoms can imply something very serious going on in your brain, whether ischemic or hemorrhagic. And unfortunately, time is brain. The difference between that and a heart attack is in the heart, we've made a lot of advances in changing out the pump, but it's going to be hard for us to recover Miss Jones' beautiful radio voice or her memories and that's why stroke, as you mentioned, is a leading cause of death, but it's also a leading cause of disability. And that really affects patients and their families.
Now, does this also include stroke and heart attack? Is different from heart failure?
It is. So heart failure is usually a chronic issue that patients take medications for and try to increase that functioning. So there's some similarities in terms of taking medications and possibly doing therapy, but it is different from heart failure.
All right. Ms. Dornan, what are some of the signs and symptoms of stroke, and I remember in earlier broadcast a term called BFAST. What does that mean?
So we use BFAST to remember the signs and symptoms of stroke. All of these would be sudden signs, so something that's coming on all at one time, not something that has a slower buildup happening. So the B stands for balance, so a change in balance, dizziness, or difficulty walking. The E is for eyes, so a sudden change in vision in one or both eyes. The F is for face, so facial drooping, numbness, tingling. It's usually one-sided. If you were to ask someone who's having a stroke to smile, they might only be able to raise up one side of their face. The A is for arms, so this is where you see when someone's having a stroke and someone asks them to raise up both of their arms, one arm may drift down to their side due to weakness. There could also be numbness or tingling, that would count as well. The S is for speech, so any change in speech that occurs and comes on suddenly. It could also be that the person is having difficulty comprehending someone else speaking to them. So if someone seems like they're having sudden onset of confusion, that kind of ties into that speech part as well. And then the T just means time to call 911, which is just a reminder that for any single symptom of stroke, it's really important that you call 911.
Dr. Stumantes, do the symptoms differ? Like I noticed that a lot of times when it involves the heart, symptoms differ between men and women. So do these symptoms differ between men and women?
They do not differ because they just don't. I know a lot of times we make a lot of parallels with the heart attack symptoms, and for women it can be more subtle. I think sometimes the symptoms are the same, but as we go through our busy everyday lives, as we'll kind of touch on later in the broadcast, those things get diminished. But the symptoms are similar. And that's why we really push the BFAST scale, as Megan discussed, because that's across ages and gender.
Ladies and gentlemen, Cape Fear Valley neurosurgeon Dr. Melissa Stumantes and Cape Fear Valley stroke coordinator Megan Dornan on Making Rounds Live. If you have a question for these ladies, you can contact us at 910-483-6111. Again, that's 910-483-6111. Miss Glenda, an amazing lady. She will answer the phone, write down your question, and make sure that we get that question and can get that question answered while we're in the studio today. In addition, if you're following us by way of Cape Fear Valley's Facebook page or the YouTube channel, what you can do is leave the comments or leave the question in the comment section, and Lindsay will make sure that we get that question and we can get that question answered for you. And finally, once again, if you do call the station, make sure that you say hello to Pastor Paul. That's what I call him, because Pastor Paul is over there pushing the buttons, and if he decided he didn't want to push any buttons, we wouldn't be on the airwaves. So make sure that you say hello to Pastor Paul. Ladies and gentlemen, Dr. Melissa Stumantes and Megan Dornan on Making Rounds Live. Dr. Stumantes, what about risk? Is the same, you said the symptoms were basically the same. Are the risk the same also?
So the risks actually aren't the same. Women have this unique period of pregnancy where we can have increased incidence of strokes, and medications like birth control pills can affect that. Men have higher rates of smoking, so that can contribute to their stroke risk. Things across both sexes include diabetes, high blood pressure, and atrial fibrillation.
Ms. Dornan, do we know why women have a higher risk for stroke?
Yeah, Dr. Samadas kind of just touched on that. It's we have a higher risk for stroke throughout our lifetime. So at different periods throughout our life, our risk will be higher, like pregnancy or menopause if they're taking hormone replacement therapy. The American Stroke Association estimates that 1 in 5 women will experience a stroke at some point in their life. And women who are pregnant are actually 3 times more likely to have a stroke than women who are the same age and not pregnant. So that phase of life especially really puts them at a higher risk. Blood pressure. So while a woman is pregnant, she has a condition called preeclampsia that causes to have her higher blood pressure. That's part of the reason that we may see a higher risk for stroke.
Do are there any special things that women can do to lower their risk of stroke?
Yeah, they can. So women should, while they're pregnant, definitely be getting prenatal care and postnatal care. Those appointments, every time they come in, one of the first things that they're going to do is they're going to check their blood pressure. And that's super important to help figure out the risk for stroke and hopefully lower their risk of stroke. They also should be following up with their primary care provider throughout all phases of life, just like anyone else should be, and following their instruction on how to mitigate their risk factors.
The American Stroke Association, they have a statement on their website for Stroke Month. And this, to me, it was kind of a scary statement. Stroke can happen to anyone at any age. Now, I'm probably showing my age by saying this, but to me, I've always associated stroke with the older generation. I've never associated stroke with the younger generation. So, Dr. Stamatis, if this statement is true, what can a person do if they're more at risk of having stroke, let's say beyond the gender, beyond race statistics?
Absolutely. There is a fear when you hear statements like that, and a lot of times we get paralyzed because we can't change our racial background or our gender or our age, unfortunately. But there are a lot of tools at our hands, and we do have control of things like our lipid panel and our blood pressure and our weight. Now, those aren't things that change overnight. As many people have experienced, weight can be easy to gain and harder to lose. But sticking to things like a low salt or Mediterranean diet, knowing your A1C number if you're diabetic, and smoking cessation go a long way in controlling someone's stroke risk, and to build a partnership with your physician as well. So regular physician visits, and now using electronic medical records, a lot of times patients can get information regarding the side effect profiles of medications and why you need to take a medication for your blood pressure or your cholesterol or your diabetes. And reaching out if you have a problem with obtaining or taking that medication is crucial.
You mentioned Mediterranean diet. In case our listeners and our viewers don't know exactly what a Mediterranean diet is, what does that mean?
So that means avoiding like butter and fried foods. Don't hate me for saying that.
Everything we eat,
and
just about
trying to keep, so that's fresh vegetables, using maybe alternate sources of protein besides beef, so fish, legumes, and trying to use minimally processed foods so you don't get into trouble with your sodium.
All right. Ladies and gentlemen, Dr. Melissa Stumati and Megan Dornan on Making Rounds Live. Ms. Dornan, is there anything people can do to lower their risk of stroke?
Yeah, so a lot of the things that Dr. Stamatis had just said, but to expand on that, if you already know that you have some risk factors for stroke, so the common ones in this area would be high blood pressure, high cholesterol, diabetes. Make sure that you are following up with your provider. If you have high blood pressure, I really recommend taking your blood pressure at home and keeping a log of that and taking it with you to all of your appointments. Yeah.
Please say that again,
Yes.
because so many people are in denial.
Yes, if you have high blood pressure, if you've ever been told that you have high blood pressure, I recommend getting a blood pressure cuff and taking your blood pressure at least twice a day at home at the same time, and then writing down your blood pressure in a log and bring it with you to all of your appointments. That way, the doctors that you're going to go see can treat your blood pressure based off of what it is at home versus the single reading that they're getting at the office, because those two things may differ.
And one other question, what is a safe high blood pressure read? Because there are so many people, and I was one, 200 over 180. I walked around with that
My
blood pressure
goodness.
every day.
Yeah.
I know, I see everybody's facial expression right now. So I'm not that now. Now I think it's like 145 over 170, and they're still concerned about the top number. but it's not like it was before. So what is a safe number?
Yeah, so a lot of people will probably be surprised to hear that it's 120 over 80 is what the goal really is. Some, depending on what your provider says, some may go up to 130 systolic, which is that top number, but you really need to try make modifications in your life to lower your blood pressure to that number. Any sort of improvements that you're going to make to lower it is going to help you in the meantime, but that long-term goal should definitely be the 120 over 80.
All right. Dr. Stumati, are there different kinds of strokes? And I also want to talk about the patient's perspective, how they look and how they feel about everything. So what are the different types of stroke, and what about the patient's perspective?
So from a patient standpoint, the two types of strokes, hemorrhages or ischemic stroke, actually look the same, because both of them affect brain tissue and cause dysfunction. So that's why it's important to get to an emergency room so that you can be evaluated, because the treatments vary greatly for those two types of strokes. Patients are only going to notice those symptoms, and again, that's why we're going to put you back to that scale and consider BFAST. If you are noticing any of those symptoms, that's why it's important to reach out to a provider. Because there are stroke mimics as well. For patients who do have diabetes, if your blood sugar gets too low, or there's other intoxication, electrolyte abnormalities. So it's important that the patients only have to remember that BFAST acronym, so that they're able to tell if they're basically a measure of brain health, and it's quick and easy to do.
You mentioned electrolyte abnormalities.
Yeah.
What exactly is that?
So that if our things like our potassium, our sodium, we're about to go into the summer months. If people are on blood pressure medications and don't necessarily stay hydrated, those can cause some low levels in the blood that can lead to things like the patient feeling tired or off balance or dizzy.
That happened to me last summer. Okay, thank you for mentioning that. Ladies and gentlemen, Cape Fear Valley neurosurgeon Dr. Melissa Stumatis and Cape Fear Valley stroke coordinator Megan Dornan on Making Rounds Live. What is the most common cause of a bleeding stroke?
The number one cause is hypertension. And so that's why it is important to stay on your blood pressure medication. Hemorrhages, there's a workup that needs to be done, and that's why it's also important to present to your physician's office or an emergency room. So those can include other causes such as aneurysms, such as amyloid angiopathy, another doctor phrase there, or vascular malformations in the brain.
Aneurysm, is that the same as a bleeding stroke?
It can cause bleeding. It's a type of cause of bleeding, but from a patient standpoint, the symptoms are going to be like a stroke.
Okay. Now, since we're talking about aneurysm, can you expand on that a little bit? Let's talk about the symptoms. Are there any symptoms that are specific to aneurysm?
So aneurysms do not cause ischemia. They cause hemorrhages. And so a lot of times, if you look across different countries, different languages, people describe the worst headache of their life. And so a headache that is often described as thunderclap. So it's very, very severe, as Megan touched on at the onset, and it will usually stop people in their tracks. So dangerous headaches often include headache with vomiting, headache with blurred vision, headache with neurologic symptoms.
Now, Ms. Dornan, what are the causes, or are the causes of aneurysm, are they known? Or, okay, either one of you can answer this question. I guess I'll go back to the doctor for that. Doctors, are the causes of aneurysm, are they known?
So the brain is a really unique environment where you have two vessels in the front, the carotid arteries, and you have the vertebral arteries from the back, have to branch out and cover the entire cerebrum. So there's a lot of branching points in the brain that aren't necessarily present in other parts of our body. So there's more areas for weaknesses in the vessel wall to develop, and that's why brain aneurysm is so serious.
We're in the middle of an interesting conversation on Cape Fear Valley Health's Making Rounds Live, and you still have time to join the conversation if you would like to. You can call the WIDU studios at 910-483-6111. Again, 910-483-6111. Or if you're watching the live stream by way of Cape Fear Valley's Facebook page or by way of the YouTube channel, you can leave the question in the comment section of the Facebook page. Lindsay will make sure that we get that question answered. And I forgot to tell you this the first time, make sure you share the video. It's kind of like an algorithm thingy, so make sure you share the video. Today, our guest in the studio on Making Rounds Live, Dr. Melissa Stoumatis and Ms. Megan Dorman. Now, Dr. Stoumatis, I know people who actually do this, and they know who they are too, because they're watching. And if you're having any of these symptoms, why is, I'll just try to sleep it off, or let's see how I feel in a couple of hours, why is that not a good idea?
So we're talking specifically about hemorrhages today, but any type of stroke, hemorrhagic or ischemic, it's important. There's a huge divide in the treatments between them. So if you have a hemorrhage and you are taking a few aspirin and going to sleep, you could potentially worsen that problem.
Ms. Dorman, how long could a person be experiencing a stroke? And I didn't know this was actually possible, but how long could a person be experiencing a stroke without medical intervention?
Well, the right answer would be you don't want to wait ever. You just want to call 911 as soon as you're having any single symptom of stroke, because you don't know what type you're having. And you are never certain if you're having a stroke. So if you're just having one of those BFAST symptoms, it's better to be safe and get checked out and rule out the worst case scenario than to stay home, maybe sleep it off, try to eat something. Don't do that. Just call 911.
And so our listeners will really, and viewers will really understand this, BFAST. Do you have to experience all of the symptoms, or can you just experience a few of the symptoms?
No, it could just be one symptom. It could just be one symptom. It could just be a small stroke. But either way, even if it is just a small stroke, that could mean that you're at a higher risk to have more strokes in the future. So we want to mitigate your risk factors now while it's just that small stroke before it turns into something potentially bigger.
Dr. Stoumatis, what about after a person has had a stroke? Are there resources available in the area, especially if they might be dealing with, let's say, complications afterwards?
So the best thing about coming to the hospital is, one, you will get a follow-up call from the stroke coordinator, which helps with that immensely. The other thing people start to realize, like when any of us get sick, so family and friends will certainly, because as we mentioned before, it's a cause of disability as well and not just death. And there's also a bunch of incredible therapists in the area with things like low vision therapy, driver's evaluations, vestibular therapy for worsening balance. And I have to give a shout out to the nursing staff at the Neuroscience Institute, and they help our patients too.
All right. Ms. Dornan, is a person at a higher risk for, well, you pretty much answered this, but I just want to make sure that our listeners and our viewers heard it, because to me it's really important. Is a person at a higher risk for another stroke if they've already had one?
Yes, unfortunately they are. The reason for that is because those risk factors that you've had accumulated over time, they don't just vanish overnight. So after you've had that one stroke, it's not like one event, okay, we're done. It's going to take some time to mitigate those risk factors. And some risk factors actually cause permanent change to the vessels of your brain that make a good environment for a stroke to occur, which is something that no one wants to hear. So that just drives home the point that it really is so important that once you've been discharged, that you've really understood your discharge instructions, made your follow-up appointments or gone to your follow-up appointments, take your medications as directed, and make those lifestyle changes to reduce your risk.
And you've pretty much answered this, but you talked about it at the beginning of the broadcast. Can a person or can a patient do to lower their risk? What can patients do to lower their risk of having another stroke? Please stress that again in case they were halfway listening, in case they just tuned in case they caught the tail end. This is very serious to me, people. So this is the reason why I want you to get this information. So once again, what can patients do to lower their risk of having another stroke?
So I'll start with when you're in the hospital. When you're in the hospital, first we're trying to find out, did you have a stroke? Once we get the yes or no to that question, then we can find out why. So we're working on the why in the hospital, and then we're figuring out which follow-up appointments you need with which specialists to help mitigate your specific risk factors, because no two stroke will be necessarily the same. So say one person has high blood pressure, high cholesterol, diabetes. They need to be going to those follow-up appointments, taking their medications as directed, figuring out some lifestyle changes that will fit with their life. You don't want to go out and try to change everything at once because it's not going to happen. I will say that the American Stroke Association website has a lot of really great resources for recipes, different ways to get your exercise in, low-cost, effective ways to help change your health. Also, some people may have a condition called AFib that puts you at a higher risk for an ischemic stroke. So it's really important that you go to those cardiology appointments, that you're taking your blood thinners as directed, I can't stress the follow-up enough.
And once again, people who are diagnosed with AFib, they are at a high risk,
Yes.
correct?
Yes.
All right, I just wanted you guys to understand that. Dr. Stumantes, is stroke recovery, is it going to be more about taking medication, more about doing the therapy, or is it going to be a combination of both?
So the most important thing is not to ignore it. Taking medication, and that it may be the same medications as home, but with different doses. So staying compliant with those medications. Again, if there's a problem with cost or side effects, to reach out to your prescribing provider. Therapy can involve, obviously, the physical ailments. People think about the speech and weakness, but a lot of times there can be a period of depression or adaptation to the new lifestyle, and there is a stroke recovery group in the community to help with that.
So people who suffer from stroke, there is a possibility of mental health issues as well?
Absolutely. So people may need tools sometimes after a large stroke, immediately just to eat. Sometimes we're celebrating when people are able to consume applesauce independently. So that can be a huge change for a mother who was taking care of 4 children and can no longer speak, or someone who was driving themselves around the neighborhood and now has lost the ability to drive.
Let's talk about the kinds of medication. And also, with any medication, there's always side effects. So let's talk about what kinds of medication do we give patients who are recovering from stroke, and what are the side effects that come along with those medications?
Yes, so there's a few categories we absolutely should cover on this broadcast. That includes antiplatelet agents. The commercial names for those are often aspirin, so like Abair or Plavix. Those are a type of blood thinner. So if you have a fall, if you have a severe headache, if you're noticing significant bruising or bleeding complications, a physician absolutely needs to be aware of that. Then there's a medication called statin drugs, and those can help lower lipids. A lot of times patients, now on discharge, they may be sent home on a certain dose, and if you have side effects, there are ways to lower that dose. The main side effect of that, sometimes people describe a cramping sensation, and that can change with time as well. Then there's other blood thinners that may be under the direction of a cardiologist or a neurologist to lower the stroke risk in patients with atrial fibrillation.
Now, ladies, before we end today's broadcast, I call it, let's go around the table. And are there any messages? Are there any thoughts? Is there any information that you would like to leave with our listeners before we close out today's broadcast?
Sure, I'll start. So I will put a plug for our stroke support group. We are called the Life After Stroke Team. We meet monthly, the third Wednesday of each month at 3 o'clock at the Inpatient Rehab Center. If you have any questions about that, you can always reach out to me. I will have that be put onto the Facebook so then they know where to go and how to reach me. You can sign up for monthly reminders. I'll call you the day before to remind you that group is happening. We try to have a speaker every other month, and then on the off months, just let people talk about their wins, their losses, things that they're struggling with, offering help to others. So it's a great group, and it's probably my favorite part of the job. So please, if you have any interest or if you know of any caregivers, survivors of stroke, family members of those with stroke, just reach out.
Okay. And Dr. Stamati?
Like you mentioned, stroke can be scary. And so a lot of times there can be the feeling that you just kind of will say, well, a stroke happened to me, shrug your shoulders. But hopefully we've given patients some tools today to understand that there are ways they can lower their risk so that it doesn't happen again, and that there is life after stroke. It may include some medications and it may include some therapy, but it's no less fulfilling.
And this question just popped into my head before we close out. If a person has had a family member that had a stroke, does that necessarily mean that family members will also have a stroke?
So if they are blood relatives, there is a risk. It can be familial, that you have a higher risk for stroke, but it doesn't mean that you will have a stroke.
All right. And Dr. Stamati, on the medical end of that, the doctor end of that,
Sure.
Would that be the same?
There are some hereditary causes of bleeding, and those can happen. And we do see like groupings like in heart attack. Oh, my father had one and my uncle on that side. So that's why it's even more important to check in regularly with your physician and modify those risk factors that you can.
And the reason why I asked that, ladies and gentlemen, is because all the medications that you heard the doctor talk about today, I'm on those medications. Everything that we've discussed today, I've had relatives, mothers, mother, grandmother, and father all died of heart attacks. So, but at the same time, I've outlived all of them, and that was because I decided to change my lifestyle. Was it easy? No. And the thing about it is, nothing that is important, nothing that is special, it never is easy, because if it was easy, everybody would do it. So, but it's something that it's a decision that we have to make. If we have grandbabies, like we were talking about at the beginning of before the broadcast, if we have grandbabies, we want to be around for those grandbabies for a while. We want to see them grow up. We want to see them go to college. We want to see them have their own lives. So in order to do that, you have to make some changes. It's not going to be easy, but it can be done. Now, let me get off my soapbox and say, ladies and gentlemen, please join me in thanking today's guest, Cape Fear Valley neurosurgeon Dr. Melissa Stumati, and Cape Fear Valley stroke coordinator Megan Dornan. Ladies, thank you so much for being on the broadcast. Thank you so much for the information, and hopefully we can have you on the show again.
Thank you very much.
Awesome. Thanks.
Now, I want everyone to mark this date down. This is the date of our next broadcast, which is Tuesday, May 28th. And we will be discussing services at Highsmith Rainey Hospital that I bet you aren't aware of. And we'll also talk about Black Maternal Health Month. So, ladies and gentlemen, for our producer, Shaka Jordan, Lindsey Graham, and Ray Thomas, and the hard-working team behind the scenes. I'm Omega Jones, continuing the legacy of Darvin Jones. Thank you so much for listening and watching Cape Fear Valley Health's Making Rounds Live.